Welcome to this edition of Supplement Saturday, and we're going to be talking about one of my favorites, and that is vitamin K2. So let's keep this less than 5 minutes and let's learn about vitamin K2. So a lot of us have heard of vitamin K, but typically we think of vitamin K1. And vitamin K1 is mostly known for helping our blood clot. Now, K2 does do some of that, but it's more important for bone health. Osteoporosis is something that runs rampant in this country. We don't get enough calcium. We are low in vitamin D. We've already talked about that. But another crucial factor is vitamin K2. And what vitamin K2 does is it actually helps activate vitamin A and vitamin D to do their job. And what is that? It helps pull the calcium from the blood into the bones. So some people actually use vitamin K2 as a way to help prevent the calcium from clogging up arteries. Inflammation in the arteries, that inflammation creates plaque, and then that calcifies, and that can lead to heart disease. It's why one of the tests that we'll do these days is called the coronary artery calcium score, because it looks at how much calcium is in your arteries. Well, if vitamin K2 is low, that calcium doesn't go where it's supposed to go into the bones and then gets deposited in the arteries. Another thing that vitamin K2 has been shown to do is to help with certain types of cancers. Vitamin K2 also helps us with metabolic syndrome. What is metabolic syndrome? Basically obesity. So there is evidence that vitamin K2 can help with insulin sensitivity. Insulin sensitivity is basically boiled down to how well your body processes sugars. Are you able to metabolize sugars efficiently or not? That's insulin resistance. It's the key mechanism behind diabetes. Vitamin K2 can help with that. So where do we get vitamin K2? Mainly from dairy, eggs, especially the yolks. You got to eat the egg yolk. That's where the fat-soluble vitamins are, like vitamin K2. It's a fat-soluble vitamin. Fermented foods like natto and sauerkraut. Liver, especially geese liver. If you're a liver fan, I'm not a liver fan. These are the major sources of vitamin K2, butter, and also all those other dairy products. Now, dairy is not the devil if you're not dairy intolerant or dairy allergic or have a dairy sensitivity. And there's a big difference between full-fat dairy from grass-fed cows and processed skim milk or the stuff that they serve that they call cheese, but it's not really cheese. Cheese is a fermented milk product. That's where you can get your vitamin K2 from naturally. Of course, you can supplement K2. There's a big debate about the MK4 versus MK7 form. These are the two forms that you'll see in vitamin K2 products. The MK4 is a natural form that our bodies use. We convert most of the other types into MK4, but it's not as well absorbed when you take it orally, and it has a shorter half-life, meaning it disappears from the blood quicker. So a lot of people will recommend the MK7 product because our body, it's better absorbed. It has a longer bioavailability, meaning it stays around longer, and then that will get converted over into the MK4 form. How much vitamin K? Men need about 120 micrograms a day. Women need about 90 micrograms a day. That's what the RDA is. Some people, if you're not eating these foods, do have to supplement. And in general, we do recommend that you supplement the fat-soluble vitamins together, vitamin A, vitamin D, vitamin K2, because they work together. And it's not uncommon when you see people deficient in one that they're deficient in others. And a lot of that has to do with fat being unfairly vilified. That's a whole conversation for another day. But we need these fat-soluble vitamins, and vitamin K2 is actually one that we see deficiencies in a lot. I was actually deficient when I did my micronutrient testing in vitamin K2. So it is one of the supplements that I do take along with vitamin D and vitamin A, mainly because my genetics are terrible. I have horrible nutrigenomics. Thanks, Mom and Dad. But that was about vitamin K2. I hope you enjoyed this. If you want to hear something about a specific supplement in one of these little 5-minute talks, let me know. If I get enough requests, I may actually do a full podcast on one where I dive really deep into what this does, what the supplement does, how to take it, where you get it from, a lot of all that information. But these I want to keep short and sweet. So thank you for listening, and tune in next week for Supplement Saturday. And I'm back. Forgot one thing I want to mention: who should be aware or caution when they're taking vitamin K2, and that's people who have clotting disorders or who are on blood thinning medication, because it does have a clotting effect, a small clotting effect, not like vitamin K1, but you still can run into issues there. Okay, now I'm signing off. See you next Saturday.